So hello, my name is Michael Lichtenberg from Arnsberg Vascular Centre. I'm interventional angiologist here in Arnsberg, Germany, west part of Germany. And it's a pleasure to be here and to report today on some of our trials. We learned already from the past and especially from studies that just performing standard balloon angioplasty is not enough for treatment of below the knee vessels, and especially in patients with critical limb ischemia. It seems that an intensive lesion preparation strategy is important to improve patency rate. And this is based on the aspect that recoil, dissection, or rest stenosis often occur after a standard balloon angioplasty. The second aspect, and very important aspect, is that angiography misses quite often these kind of post-interventional complication, as mentioned, dissection or recoil. And within the Prestige trial, we performed IVUS-guided atherectomy, which helped us to analyze if after atherectomy and angioplasty using a drug-coated balloon, a persistent obstruction was present and needed to be treated. And with this pilot study, we aimed to analyze this combination therapy in terms of safety and efficacy. So this Prestige trial is concepted as a prospective single-arm multi-center registry. It aims to include 75 patients. So far, 50 patients are included. The objective is to assess safety and efficacy of this IVUS-guided lesion preparation strategy using the Phoenix atherectomy before drug-coated balloon angioplasty in patients with critical limb ischemia, so patients Rutherford 4 and 5, with below-the-knee disease and moderate and severe calcification. The primary endpoints include the efficacy endpoint, patency at 6 months, which is defined as freedom from target lesion revascularization and target lesion occlusion by duplex ultrasound, core lab adjudicated. And it includes the safety endpoint, freedom from major adverse limb event and or 30-day perioperative death. So we found very interesting points, especially in terms of lumen gain. IVUS helped us to perform a much better reference vessel diameter analysis than the angio. That means based on IVUS analysis, we choose the drug-coated balloon after atherectomy. And the big difference was that the reference vessel diameter based on angio versus reference vessel diameter based on IVUS was more than 1 millimeter smaller than on IVUS. Meaning whenever we perform angio-based intervention, we underestimate the vessel diameter. This is what we learned by this study. And what we did here, that we then, after IVUS analysis, choose on this IVUS analysis the correct balloon for angioplasty. And what we could show is, in comparison to other studies, that with this approach using larger balloons below the knee based on IVUS analysis, we had better efficacy outcome than other studies which performed just angioplasty based on angio analysis. So the conclusion, I think, first of all, is that for BTK intervention, there is a need to find an appropriate diagnostic modality. We learned from this study so far, from this interim analysis, that IVUS gives us much more data on morphology, on post-interventional dissections, on recoil and thrombus. So the optimal revascularization strategy based on a diagnostic modality is to achieve optimal lumen gain and to maintain this lumen patency, because we need long patency for complete wound healing, especially for patients with critical limb ischemia. And based on our data and our preliminary interim data, which are we showing, these data are very promising in terms of safety and efficacy for the combination therapy of debulking plus DCB strategy in patients with critical limb ischemia, IVUS guided. And I think this could be a very promising approach, especially for patients with critical limb ischemia in the future. So the next step, of course, is to finalize all the follow-ups of these patients. We, of course, would like to know how the patency analysis will be after 12 months. And based on this pilot study, we will probably set up a multi-center prospective registry to learn more from other centers, from other complex patients, how this combination therapy could help patients with critical limb ischemia.